So my name is Luke Harris. I'm with Children's Mercy Integrated Care Solutions, help lead our value-based strategy. I'm the Senior Director of Operations and Population Health Management. So in that role, helping to support our population health management strategies for approximately 250,000 patients that we are have some form of value-based agreements. Yeah, so a key differentiator of what Innovaccer offers for us is how do we bring meaningful insights to the point of care? Nothing else really matters, right? Unless we're able to take the data infrastructure that we have and put it into the clinical workflow of our care teams and our clinicians. So we've done a nice job of that with InNote and its capabilities around care gaps, around risk adjustment, around closed loop social determinants of health referrals. But the piece that was missing is how do we take, rich, unstructured clinical insights and now bring them to inform that care interaction in a more meaningful way. And so we wanted to take that data, particularly data from our specialists, other primary care providers, and now very succinctly, what's happening with this patient, what follow-up is needed from either specialists or acute visits between the last time that they visited, what key medication changes have they had, but do that quickly, right? Because no doc has time to search through tons of different notes from different systems, but now have that at their fingertips. Yeah, the time was spent, it's the pajama time they often kind of refer it to. It's like trying to spend time the day before preparing and prepping in systems that are not integrated together, right? And so when they're taking that time, what we often heard, I remember a story from one of our docs, they used to do this pre-visit planning, but then they actually even stopped doing it because they would spend a significant amount of time, and now you still have to deal with the patients that no-show or don't show up, right? And now they spend all of this time, and it's time really wasted from their perspective. What Innovaccer is now enabling for us is that literally, 5 minutes before that visit, they can get a quick summary of exactly what's happening within the 30 seconds, not only with a summary of the key indicators of what's happened to that patient since the last time that they've been to my practice, to see me, what's happened to them. Imagine like the experience of a patient and family when your doctor has full visibility into what's happening to you since the last time they've been there. They're kind of like, it's not only improving the care, but it's also improving that experience, and they're able to do it in the moment right before they go in to have that encounter with the patient and family. Again, it's that what's happened to them in between the last visit, so that's been critical, and the summary, that succinctly does that. The other piece is really being able to capture the specialty visits associated with that patient, but not only like what information is in there, but what's the key outcome associated with that visit, and what was the patient asked to do from a medication adherence, therapy, follow-up, and not only like what it was, but trying to use the AI to interpret, has what the specialist recommended actually been completed, so that then the primary care provider and care team can make sure or support that patient and family in accomplishing those things that were recommended by the specialist. We've just finished kind of the initial pilot. It's been deemed a success, and now we're rolling this out more broadly for those practices and our care managers. So it's hard to quantify, except for just testimonials from the end users in terms of how valuable that the tool is, the time efficiency. Again, we haven't done any time studies, but it's a game changer for them in terms of what it takes to prep for the patient. But also, we had a period of time where it wasn't available to them, and them really kind of seeking out to us to say, hey, this is a tool I now really value and need and want as part of my workflow. So it's more of that qualitative confirmation that they're now seeing this as a part of what they need to succeed. Yeah, no, there's nothing more true than kind of the aspect of trust and managing that whole relational aspect of things. And for us, it's really been a very pragmatic approach of who are the champions, the clinical champions that are part of this effort, and picking those that not only would be supportive of the innovation, but also those voices that are going to help carry the weight in terms of demonstrating the value and being able to support that broader deployment. That's the piece here was really around the proof in the pilot and hearing directly from our end users of the value and allowing our executives and our board to also see and hear that, right? Because when we started this pilot, we wanted to kind of embrace this innovation. We felt like AI, has been focused on this scribing kind of capability, but really kind of the next piece is how do we take all of this data and information and now meaningfully bring insights? And so, it is until we kind of heard the confirmation and their desire is what's really given our executive and our leadership the confidence that this is a tool that is bringing value and we want to deploy it more broadly. I do think it's important to know and recognize that like the value of this is very dependent on kind of where you are in the market. At least from our perspective, the linking the data and information more broadly longitudinally from a primary care and a specialty setting is kind of the key aspect of the value proposition that generates here. And so, I would push them to consider how do you make sure that you're effectively capturing the unstructured clinical notes associated with your specialists, because that's what brings the value home in terms of it really being meaningful for it to be really kind of sticky in terms of the value that they're going to achieve. Yeah, so for us, it's really around the data infrastructure being already there and built and validated and curated and standardized and normalized. All of that data is there. Now let's just apply the AI capabilities to that data. And it's not even just applying it, right? Because it's then the partnership with Innovaccer to really hone in on the use cases and meet the needs from a pediatric standpoint. I mean, the development team has been fantastic to make sure that we're succinctly summarizing the content so it's easy to read from a pediatric standpoint, adjusting the vitals slightly so that they're tailored towards pediatrics, adjusting the clinical recommendations to not be so focused on the preventive standard, preventive care type of thing that every pediatrician is going to know and adhere to, but really highlighting those things that are going to be most meaningful and effective for actually improving the care that they're providing. The thing, some of the testimonies that I'm kind of thinking about is there's a lot of information that I now have access to improve my care that I didn't have access to before. I now have full visibility to the who, what, when, and what actually needs to happen relative to a specialty visit that it would have taken me hours to find that. Or, I'm seeing a lot of value in this tool and excited to share it with others in my practice. Those are really kind of the comments and remarks that resonate. Yeah. So our, bringing this to our practices, and keep in mind our practices, we have 30 different practices. All of practices are on a different EMR, so it really is dependent on the use of InNote. InNote is the capability from Innovaccer that sits on top of the EMR and essentially agnostically identifies the patient and then automatically pulls up the profile of that patient seamlessly within the workflow. Right? One thing we often say is, nothing else really kind of matters unless we can bring those insights into that clinical workflow, and that's what Innovaccer is doing seamlessly. It's now just, we've had InNote, but now how do we complement and really augment and really escalate the value that InNote can provide with the use of AI? I'm very surprised about this actually from our providers that, we did a poll and kind of getting a sense of where our providers were in terms of where they thought AI would impact their clinical care over the next year or few years. And I thought that, that they were going to be more resistant or, pushing to change. But ironically, this is something that I feel like is being embraced at a more rapid speed than what we had anticipated, right? That they're accepting, and maybe it's just because of how much AI is infiltrating kind of everything that we do, in our daily lives, that they're now coming to accept that. And now, how do we design the AI in a way that's best supportive and complementary to what they're trying to do in terms of their role as clinicians? And that's the focus of this. It's not replacing, it's not diagnosing. It's how do we bring meaningful insights within the data information that's available to them, that no one person could go and evaluate all of that, but now have it right there for them. Yeah, so we started the pilot really in summer of 2025, and it was really a couple of month process where we wanted to vet it and kind of make sure internally from a Children's Mercy perspective that we were ready to engage with our pilot practices. And so we had 3 pilot practices as well as our care integration team that piloted it from September through the end of 2025. That pilot, because of all the really the comments that I just had here, was deemed successful. And now we're preparing to deploy it more broadly across the network. We're not doing it immediately because of a Children's Mercy transition from Cerner to Epic. So we're going from Cerner to Epic on March 1st. And so we're taking these next few months to really focus on a broader deployment within those pilot practices. So we had limited users within each practice. They're now deploying it more broadly across each practice, as well as our entire centralized care integration team is now embracing and using this tool. So we went from like 10 active users, and now we have close to 50 active users. And then that'll be deployed even more broadly in the second quarter of this year as we then roll it across the network.